maternal nutrition. So, before I start boring you again with what happens with antenatal care and postnatal care, and we go dig deeper into those things. Yeah, basically, if I have to divide this topic, I've just taken it like the part before pregnancy, during pregnancy, and post pregnancy. So, again, it's during the phase where your body develops yourself, during the antenatal care, and then the postnatal care. So, if you look into a few of the statistics which comes from the WHO, it says that only 64% of the women, they receive the antenatal care. So when we talk about antenatal care, what is it? It's what you receive during your pregnancy. So until 2015, what WHO said was that it is mandatory to have at least 4 antenatal visits during your pregnancy. However, they said that the maternal mortality has to be reduced. It's very important that the women go through and they understand what their body requires. And apart from that, they are also told about what diseases they can fall prey to, or what are the conditions that they should be taken care of, or if there are any challenges that that can hamper or put into danger their pregnancy. It's very important that the number of antenatal checkups are increased from 4 to 8. So what WHO recommended in 2016 was that with 8 or more antenatal care, the number of perinatal deaths can be reduced very significantly to around 4, 8 per thousand births. So they're saying that with the increase in the number of antenatal visits, your number of perinatal deaths might come down. And that's where they said that, okay, how do we place the antenatal checkups? So for that, how they did it was their first contact will be on the first 12 weeks of gestation, followed by the 20 weeks, 26 weeks, 30, 34, 36, 38, and 40 weeks. So initially it's a 12-week period, then we have 8 weeks, then 6 weeks reduction, then it's further, it comes down to 4 weeks, and towards the end, you have visits in the last every 2 weeks. So how they have spaced it in a way is as your trimester advances, the frequency of antenatal care increases. But what does it hold importance for us with respect to nutrition? So earlier, when we were talking or when we had the concept of 4 antenatal visits, there were always, the awareness was given that, this immunization, tetanus, toxoids, those need to be taken. You should focus on your food patterns also. You should be doing some amount of physical exercise. So there was a broad mention, but that was something which was very verbally communicated during ANC, and it was not a mandate. However, when in 2016 WHO revised its guidelines, they included something extra. So what they did was they included the content on what the diet should contain. They included what amount of physical activity should be there, what you should do to avoid tobacco and substance use. These were something which were included apart from whatever your body measurements or the fetal um, diagnosis which needs to be done. So apart from the entire aspect of diagnosing and treatment if anything required, there were also guidelines which were mentioned to improve the lifestyle and the diet so that you get a comprehensive treatment. Again, it's not just about the nutrition, it's not just about your physical health. They have also considered something on the mental health. They have also given counseling that especially mothers during pregnancy, they come across things like sometimes they have a lot of anxiety, sometimes they're stressed because of the change in the emotions and their hormone levels. Their responses change to the different circumstances. So how to even deal with those are a part of the revised WHO guidelines. So this slide looks a little clumsy, it's too crowded, I understand, but this is something that I just picked up from this uh, slide. So one second. So here, if you see, if you go to the WHO website and look for this particular book, you'll find it. It's the file which says WHO recommendation on antenatal care for a positive pregnancy experience. So this is something that I just picked up very specific to the nutrition intervention. So when we talk about nutrition intervention, what WHO has said is that based on your lifestyle and your eating habits, it's necessary that you do a bit of physical activity. And if you are undernourished, you will need some interventions. You will need some intake of nutrients, micronutrients, and macronutrients. Apart from that, you will also require iron and folic acid supplementation, calcium supplements, vitamin A supplements, other zinc supplements, other micronutrient supplements, vitamin D, and there is a need to restrict on the caffeine. So broadly, this is what the interventions or what comprises in the revised WHO guidelines. They have spoken that counseling is needed on the health aspects, and based on that you need balanced diet and how your body absorption takes care, because during pregnancy the body requirement also increases a lot. So considering that, and to avoid any future conditions of the child having a situation of malnutrition, or the mother going through a process of malnutrition, so it's important that during the phase of pregnancy the women are supplemented with these items, these macro and micronutrients, so that they do not undergo the symptoms which, like um, anemia or a preeclampsia. So to avoid such conditions, they should definitely have the intakes of such macro and micronutrients. So we have been saying, or rather I told, that it's always necessary that during or through from the time of adolescence you should have the focus on nutrition, because that's where you imbibe your sexual maturity. That's where, because in India still women are still prone to getting married in their early ages. Okay, maybe the laws are still saying that it's 21 years or whatever, but even when you go to rural India, you'll see that teenage pregnancy, early childhood marriages are still very common. So that is one of the reasons that if you are living in India and you have to understand how the social cultural factors revolve around you, it's very important that as you grow up, as you are an adolescent, you start developing your body, that irrespective of the decision that you take, whether you have to be pregnant or not, but you are physically and mentally fit. So keeping into mind that, it's very important that the nutrition should always be one of your priorities, even as you keep growing in your life. And when it comes to pregnancy, we need to understand that during pregnancy and after pregnancy, your nutritional vulnerability is very high, because the requirements of body keeps changing. While you're pregnant, it's different. After delivery, it's different. So at the time of conception or during adolescence is different. As we say, your plate might roughly look like the same, but there would be minor changes depending on what supplements or what deficiencies or if you have, and what your body requires at the phase you are. Suppose in you are in your pregnancy, there will be more requirements of uh, micronutrients like zinc, calcium, etc. And when you have delivered, your body will require more of fats and proteins. So when we talk about that, apart from that situation, that how or what stage you are in, even as an individual, your body would require more energy based on conditions, like if you have become pregnant in the adolescence, or it's multiple pregnancies, or if you have an HIV infection, that's where the requirements of body will be higher. So based on CDC, considering you have there is a chance that you have one baby, or if you somebody has conceived with twins, the and depending on the BMIs you have, the number or amount of weight you gain in pounds has been defined by CDC. So you cannot be underweight and you cannot be overweight, because both of these will definitely lead to difficulties post delivery. So on the broader guidelines, if you see that as you increase in the BMI, you will reduce on the amount of weight that you need to gain during pregnancy. So for a normal women having a normal BMI ranging between 18.5 to 24.9, if you are pregnant with one child, you need to gain weight of about 25 to 35 pounds during your entire phase of gestation. And if the same female is pregnant with twins, she needs to gain a weight of 37 to 54 pounds during an entire phase of gestation. So, as I was talking about that, uh, in adolescence, how our body requirements are there. We talk about that, yes, on the broader side, how your body will require to be developed, especially when you are pregnant. So this is where we see, this is a broad chart which I was able to find. And this one talks about, how the nutrition requirement changes from pregnancy to the period of breastfeeding. So if you see here, your energy requirement, obviously, they increase till the time you deliver and in your first 6 months post delivery, because that is where your frequency of breastfeeding is also higher. So on the outset, you need more energy at that time, and after 6 months post delivery, the energy consumption reduces. So this is where you have to make sure that the female has increased consumption of starchy food, they have increased servings, and the frequency of meals also increases. When we talk about protein, so in the initial phase, when you're non-pregnant and your body needs to grow and develop, that is where you need about 46 grams per 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 serving. But after that, once you are pregnant and you have delivered, there is a constant uh, increase of about plus 25 grams, which is where you need to have the intake of animal source food, pulses, fish, and legumes. Because as we all know, proteins are the building blocks of the body. So the better you have protein intake, it will help your body develop better and contain the nutrients and store it in the body for a longer time. When we talk about vitamin A, if you see, according to the requirements, the increase is slightly higher when you are pregnant, and it increases very rapidly post pregnancy. That is where you need to supplement. So post pregnancy, once you have delivered, ideally, if there is a case of vitamin A deficiency, you should be administrating the supplement within not as soon as possible, but not beyond 8 months of pregnancy. So that is where the body requires the maximum absorption of vitamin A. So you should ensure that the deficiency should not be there. Otherwise, even in the newborn, it can lead to multiple defects. So you during pregnancy, it's important to have intake of fresh or dried foods, fortified products, and vegetables. Similarly, for iron we all know, for females, be it any phase of life, iron is very important, and especially during pregnancy, again, the requirement increases, and you need to have consumption of iron fortified food products, food which is rich in iron, and you should definitely find alternatives to tea or coffee in order to sometimes it can avoid the absorption of iron. So it's very necessary that during pregnancy and post pregnancy, you can reduce the consumption of coffee and tea. This is the next part of it, which talks about the other nutrients like folate, where again we see that during pregnancy there's a higher requirement of folate, and once you have delivered, the requirement goes down, and This requirement can again be achieved through increased consumption of green leafy vegetables. And for iodine, again, now for iodine, we can see that, as compared to folate, there is a higher intake in iodine during postpartum services like post delivery during the breastfeeding period as compared to the pregnancy phase. So this is where after delivery you should ensure that the female is advised to intake more of seafood and iodized salt, which is very much necessary. Talking about calcium, yes, so there is a constant and always a requirement for intake of milk, milk-rich products, whole fish, and calcium-rich items. When we talk about zinc, zinc is also one of the things that a nutrient which is very important because in the absence of zinc, it can lead to neural defects. So yes, so the requirement of zinc needs to be taken care of, and as we see, it is something which can be replenished, or the absorption or content or the reserve in the body can be increased by the feeding of red meat or poultry, and you can promote the germination and fermentation of such red meat and other products so that to reduce the phytate content in cereal based diets. So what happens is in the cereal based diets you have phytate which prevents the absorption of zinc, so it's very necessary that these cereals are fermented and germinated so that the phytate content is reduced. So that was about broadly on you know the during the phase of pregnancy and on the broader side of how you see for breastfeeding females. So when I was saying that adolescents we spoke about separately, during pregnancy we spoke about separately the antenatal care, the requirements or the recommendations which are being given by WHO, the sheet which we saw on how the requirements for various nutrients varies. Now when we talk specifically for the breastfeeding period, so as we understand that in the breastfeeding period the body requirements increases by at least 330 to 400 kilocalories more because you are supposed to replenish yourself and you are also supposed to feed the infant. So that is where your body requires more nourishment. So during that point of time, what all needs to be taken care of? Of course, for vegetarian and vegan diet females, it's very important that they have an intake of vitamin B12. We need to prescribe them because usually in vegetarian females, they are prone to have a deficiency of the same. Other nutrients which can be prescribed are chlorine, zinc, iodine, and omega-3 fatty acid. Then we talked about vitamin. Again, as we said, vitamin A, if there is a deficiency, we need to make sure that once the delivery has been done, the women should be administered with vitamin E supplement no later than 8 weeks. Then you should definitely ensure or prescribe that intake of caffeine needs to be reduced. We have been talking about this since the beginning that whether it's during pregnancy or adolescence or in any given phase of time, it's not always good to be heavily dependent on the intake of caffeine, sugary drinks or tea. It impacts your body at times. There might be a psychological feeling that it relaxes you, but somewhere it doesn't. And especially in women with pregnant women and breastfeeding women, it is not something which needs to be continued. It can lead, higher intake of caffeine can lead to fuzzing and irritation and at times even disorientation. Moving to women with anemia, they should, if they have been diagnosed with anemia, even during their antenatal checkups and post delivery also, depending on the prevalence of anemia, if it's higher than 40%, they should definitely be provided with supplementation up to a period of 3 months. And if it's less than 40%, then yes, you can have frequent visits with them. And depending on how their body absorption takes place, you can then stop the supplements, but up to a maximum of 3 months, the women can be given the supplements for anemia to treat anemia. Then when we talk about seafood, so we understand that for a lot of nutrients, the seafood or fish, they are really good. But what happens is that some of the fishes, they contain mercury. So when you are having seafood intake, especially after delivery, you should ensure that you're not having intake of such fishes, because what happens is it goes and accumulates in the body and then it's passed down through the breast milk. So that again can lead to major concerns, something like Minamata disease, that is due to the mercury poisoning. So there needs to be a lot of cautiousness that what happens if you take that. So seafood, it's always good to have such nutrients. It's good to take food like that, but you should always be cautious that you are not taking or having any toxicity built inside your body. Then again, vitamin C. So even on general day, we always say that adding vitamin C is very important because that improves the absorption of iron in your body. So apart from the other nutrients that are prescribed, depending on whether you have deficiency or not, vitamin C, again, it's a chewable tablet usually, and you do not need to take water. So either you get it from the sources, natural sources, or it can be prescribed along with the other nutrients. And lastly, there's something which is very important to be understood, and especially in low and middle income countries where food, sanitation, hygiene is a big question. You need to make the people be aware of nutrition education, food hygiene, and dietary practices. So, all the nutrients, all of these supplements will work, but on a basic note, you need to maintain your hygiene. So, like you have your sanitary and wash practices, similarly, there is a need to maintain clean environment and ensure that the food that you eat is very hygienic. So, this is where I thought I'll introduce this topic of food hygiene. So, as I said, that everything talks about itself, about supplements. You people are from medical background, so these are things that you will already know. You would have seen patients, but on a general day, at times these are very basic things that we forget. We tell our patients, but sometimes they follow, sometimes they don't, sometimes even we tend to forget to inform them. So these are the 7 C's which needs to be practiced. So if you have a patient who comes to you during their checkup, it's important that we tell them about food hygiene as well. So when we talk about food hygiene, so there are 7 C's to it. If you see, the first one is avoiding contamination. So if you have cooked food and raw food, keep them apart. The other one is covering the food, whether it's within the refrigerator or it's outside, whether it's drinking water, whether it's food, always keep them covered. Next thing is cleaning. Whatever we consume, we need to clean that and eat. These days there are so many pesticides. They say that it's all organic, but you never know if there are pesticides used or whatever it is. Even if it's organic, when you get it to your home, make sure that the food whichever you are intaking, be it a whole fruit or be it vegetables, make sure that it's cleaned thoroughly. Check the food which you buy, which is very important. Because of the consumer awareness and a lot of things like that, we are aware that yes, every time we take a packaged item, we see what is the expiry date, and then we ensure that yes, the food which is intaken, or whichever we purchase is good. But in areas which are poor and people do not have access to such facilities, sometimes they do not even care checking if the material which they have purchased or the food they have purchased is good or not, or whether it's crossed the expiry date. So it's again very important to remind them that if you are taking anything inside your body, make sure that it's well within the given time and it's not beyond the expiry date. Cooking. When we say cook, cook the food thoroughly. You do not have to burn it, but ensure that the food has been cooked thoroughly. It's not raw anywhere. Ensure that every time, especially if a pregnant woman or a breastfeeding woman is eating, that the food is freshly cooked. You should avoid providing them food which has been refrigerated. Then, when we talk about the food items, like the poultry and meat, those things which need to be refrigerated, make sure that you put them in the freezer as soon as you get it from the market. And before you use them, make sure that you clean them nicely and thoroughly before you are using them for cooking. So keep them separately, clean them and put it in the fridge. And then when you're using it, make sure that it's well cleaned and then cooked properly. And consumption, which is again very important as it is to ensure that your food is cooked in a nice, clean area. Similarly, it's very important that you consume food in clean plates and vessels and you nicely wash them after using. So, food hygiene is also an inevitable part of nutrition. That is something which we all need to keep in our mind. We talk about medicines, we talk about nutrition, but something like this becomes the basis of it.